Welcome back, everyone. Today, we're going to do a deep dive into something that's been around for a long time,
Oh, yeah.
TB, tuberculosis. Um, and you, the listener, you've provided some really interesting courses on this.
Great.
I mean, it's one of the oldest diseases in the world, right? Still widespread. So it's been a real problem for a long time and still is today. I'm excited to kind of get into it and see what we can uncover here together.
Definitely.
I mean, we all kind of have a vague idea of it, like it's a lung thing. Right.
Yeah.
It affects the lungs.
Primarily, yeah.
But one of the things that I think is so fascinating about it, it's not just the lungs.
It's not, yeah.
It can affect so many other parts of the body,
Yeah.
and it can stay dormant for years and years and years,
Yeah.
even decades, before it reactivates. And then there's that one that I always think about. I'm like, oh, that's creepy. Miliary TB.
Yeah.
It's like it spreads like little seeds all over the place.
Uh-huh.
And also, this isn't something that just goes away in a week. I mean, treatment, 9 months.
A long time.
That's a commitment. So I guess let's just start at the beginning. Like, what is this thing?
Okay, so tuberculosis, or TB, is an infectious disease. It's actually a chronic bacterial infection, and it's caused by this bacteria, Mycobacterium tuberculosis. It's a rod-shaped bacteria, and it primarily attacks the lungs, as we said, but it can affect other organs as well.
So how does it actually get into our system?
It spreads through the air.
Oh, wow.
Yeah.
Airborne.
When someone who has active TB coughs, sneezes, sings, even talks,
Oh, wow.
tiny little aerosol droplets.
So they're just putting it out there in the air.
Yeah, they are.
Oh, that's a scary thought.
They're really tiny, like between 0.5 and 1.0 micrometers. So you can imagine how easily they could be inhaled.
Wow.
Yeah, and they can remain in the air for hours.
So anybody in the same airspace could potentially
Absolutely.
be at risk.
Yep.
I don't like that. Okay, so then it gets into our lungs. Like what happens once it's in there?
Okay, so you breathe it in, and then it goes down into your lungs, into your alveoli, and that's the tiny little air sacs that are responsible for exchanging gas in your lungs.
Okay.
Over the course of a week, these TB bacilli, which is what these bacteria are called,
Okay.
they multiply, and they cause an inflammatory response similar to pneumonia.
Oh, so that explains like the cough, the persistent cough that people always think about when they think about TB.
That's right, yeah.
Okay.
So you have all these white blood cells, right, that rush into the area to try to fight the infection. But here's the thing. They can't actually kill TB bacilli.
Oh, wow. So they're not effective.
They're not effective at killing them, but they're still in there fighting, so they get engulfed by macrophages, which is another type of white blood cell. But these bacteria, they can survive inside of these cells, so it's like this ongoing battle.
Oh, my goodness.
Right.
It's a war zone in there.
Right, and then, the macrophages start releasing all these chemicals, which causes fluid to build up in the lungs.
Which is going to make it hard to breathe.
Right.
So this is sounding really uncomfortable, I got to say.
Yeah, and at this stage, the tuberculin skin techs, which we all know, if you'd been exposed to TB,
Yeah.
it would come back positive at this stage.
But does that mean that you have active TB?
No, not necessarily. It
Oh.
just means that you've been exposed. Your body has mounted an immune response.
So you've encountered it.
And you have an immune response. It could be latent TB, which is the dormant form,
Right.
or it could be a past infection that's no longer active.
Okay. So your body's in there fighting. It's not like an immediate knock-out punch.
Right. It's a battle.
What happens next in this battle?
Well, the lung tissue starts to kind of fight back. It starts to build up these protective cells that are called tubercles. You might hear them called granulomas.
Okay.
And they encapsulate the TB bacilli. They form these little prisons, these tiny prisons,
So the body's trying to contain it.
contain the infection. Exactly.
It's like these little fortresses in there.
And inside these tubercles, they have this substance that kind of looks like cottage cheese.
Ew.
So they're called caseous granulomas.
Okay, so that's the body's way of trying to prevent it from going crazy all over the place.
Right. And if it's successful, then the TB bacteria become inactive. The infection goes into a latent phase.
So it's still in there, but it's like on lockdown.
Exactly, yeah.
Latent TB?
But you said it earlier, TB can reactivate. What makes it reactivate? Well, a weakened immune system.
Oh.
That's the main culprit. So if you have HIV infection, or maybe you're malnourished, you're on certain medications, aging can even cause it, or just prolonged stress. Anything that compromises your body's defense, it can give TB an opportunity to stage a comeback.
So it's like a volcano. It's like a dormant volcano. just waiting for
Absolutely.
the right conditions.
And when TB reactivates, the symptoms are way worse. You're
Oh.
talking persistent low-grade fever, like you feel bad all the time, drenching night sweats, extreme fatigue, a cough that just won't quit. And that cough, a lot of times it comes with green or bloody phlegms.
Ugh, okay.
Yeah, you can even have chest pain, especially when you breathe.
This is sounding much more serious.
It is.
So is a person really contagious at this point?
Yes, very much so. Yeah. And in severe cases, that cavity where the TB was contained,
Uh-huh.
it can actually rupture and it can allow that infectious material to spread even further within the lungs.
Oh, so it's breaking out of its little prison,
It is.
and then potentially it can get into the bloodstream.
It can, yeah.
Wow.
And that can lead to even more complications.
Okay, well, this has been, it's a lot to take in already. Just thinking about, getting into your system and then how the body tries to fight back. Creating those little fortresses in there, the tubercles, and then going latent, but also potentially reactivating. And now we're hearing about it spreading, potentially getting into the bloodstream. This is a bit scary.
Yeah,
A lot to think about.
it is a serious disease. Yeah.
So we're talking about it spreading, potentially even getting into the bloodstream. And I know you mentioned disseminated tuberculosis. That's when it really starts going to other parts of the body.
Right, that's the most severe form.
Yeah, that sounds really bad.
It is.
And why is it called miliary TB? Miliary. That sounds almost military.
It is. It's because when TB spreads throughout the body, it forms these tiny tubercles in different organs, and they're about the size of millet seeds. So, like, teeny tiny.
So it's not just like one battle zone in the lungs anymore. It's going to other places. Like, where does it tend to go?
It goes to places in your body that have high blood supply.
Oh, okay.
The liver, the spleen, bone marrow. It can even go to the brain.
So it's like it broke out of those little prisons that your body tried to build. And now it's like,
It did.
okay, it's on the loose.
Exactly.
And it's setting up like other places all over the body.
It travels through the bloodstream or the lymphatic system to these other organs.
And what kind of damage can it do in these new locations?
Well, it depends on the organ. If it goes to the brain, it can cause meningitis.
Meningitis. I know that's really serious.
It is very serious. It's the inflammation of the membranes surrounding your brain and your spinal cord.
And it goes to the bones.
Bones, it can cause pain, weakness, even fractures. And the kidneys, it can impair their function, really bad complications.
So this is not good. Are there any ways to tell that it's gone beyond the lungs?
Well, the symptoms are different depending on where it is. So you might have a persistent fever, unexplained weight loss, you're fatigued, you have night sweats, your lymph nodes might be enlarged, or sometimes it's more vague, like you just don't feel good.
So you just don't feel well.
You just don't feel well. That's why early diagnosis is so important.
Okay, so let's talk about that. Diagnosis. So we know there's that TB skin test that can show if you've been exposed to it at some point.
Right.
What other tools do they have to actually diagnose it and figure out like how bad it is?
Sputum testing is one of the major ones. So analyzing that phlegm that you cough up from your lungs,
Okay.
see if it has the TB bacteria in it. We usually collect 3 samples at different times just to make sure.
3 different samples. That's pretty thorough.
Yeah, you got to make sure.
What if someone can't cough up enough? Like they just can't produce enough sputum?
That happens, we can do a bronchoscopy. So we put this thin tube down into the airways. It has a light and a camera on it. And then we take samples directly from the lungs.
Oh, wow. That's a bit more invasive, isn't it?
Yeah, a little bit.
Are there any less intrusive ways to go about it?
We do have blood tests that can detect the immune response to TB. There's the QuantiFERON TB Gold test, and then there's this really cool one, the Expert NTB BRIF assay. That one can detect TB DNA directly from a sputum sample, and it can even tell us if the bacteria are resistant to rifampin, which is one of the antibiotics that we use to treat TB.
So that gives you like a heads up if the usual treatment's not going to work. What about imaging tests? Can they actually see TB in the body?
Oh yeah, we can see it. Chest x-rays, that's a great way to look at the lungs and see if there's an infection there.
What would you be looking for on the chest x-ray?
So we look for areas that have more density than usual. It shows like inflammation or fluid buildup. We might see small calcified lesions. Those are called Gaunt nodules.
Okay.
They tell us that maybe there was a past infection. If it's more serious, we might see cavities, which are basically holes in the lung tissue.
So it gives you like a visual map of the damage that the bacteria are doing in there.
Pretty much.
What about other imaging like CT scans or MRIs?
CT scans are really good. They give you a more detailed look at the lungs, other organs that might be infected. They tell us how bad it is, where the lesions are. MRIs are really good for looking at TB that spread to the brain or the spine.
So it sounds like you've got like a whole toolkit to really figure out what's going on.
Yeah, we do.
But even with all this technology, it can still be hard to diagnose, right?
It can, yeah. TB can look like other diseases, and the symptoms, especially early on, can be so subtle. That's why it's really important to have a high index of suspicion, especially if someone is more likely to get TB, like if they have a weakened immune system or they've been exposed to someone with active TB.
So early diagnosis is key.
Very key.
Okay, so we've seen how TB can spread throughout the body. We've talked about all the different ways that doctors can diagnose it and figure out what's going on. And we know it can be tricky because it can look like other things. But what happens when they do make a diagnosis? What are the next steps to deal with this thing?
That's where we get into treatment and prevention, which is a whole other ballgame.
Treatment and prevention. All right, so we know what this thing is. We know how it gets in there. We know how they figure out if you have it. How do we fight back?
The good news is TB is treatable,
Okay, good.
even curable,
Even better.
with the right approach. But I said it before, it's a marathon, not a sprint.
So there's no quick fix.
No quick fix, no.
How long are we talking? How long does treatment usually take?
At least 6 months?
6 months.
At least sometimes longer. It depends on, what kind of TB it is, how bad is it.
Okay.
And it's a combination of antibiotics. You got to take them consistently.
Every day.
Every day, yeah. Or maybe a couple times a week.
I mean, I can only imagine that it's got to be really hard for some people to like stick with it.
It is. Adherence to the treatment is one of the biggest challenges.
Yeah, I can imagine.
If you stop taking the medication too early, you miss doses. Not only can you relapse, but then the bacteria can become resistant to the drugs.
Oh no, even worse.
Yeah, much harder to treat.
So what kind of antibiotics are we talking about here?
Isoniazid, rifampin, those are two of the main ones. Pyrazinamide, ethambutol, those are the first-line drugs for TB. They all work a little differently, so they attack the bacteria from different angles to make sure it's effective.
It's like a multi-pronged approach.
It is.
Are there downsides? Side effects we should be aware of?
Oh, there can be. There can definitely be side effect. You always want to talk to your doctor about this stuff.
Yeah.
One of the things about rifampin, it can turn your urine orange, bodily fluids orange.
What?
Yeah.
Orange?
Orange. It's harmless, but it can be kind of freaky if you don't know it's going to happen.
Yeah, if I just suddenly saw that, I'd be like, what is happening?
Right.
Okay, so orange. Okay. Anything else?
Some people, they get nausea, vomiting, lose their appetite,
Okay.
skin rashes, joint pain.
So it's not a walk in the park.
No, it's not. And some of the drugs, like isoniazid, they can affect your liver, so you have to get regular blood tests to make sure your liver is okay. There are some rarer, more serious side effects, but those are, less common.
It's like a balance, right? You want to kill the infection, but you don't want to damage yourself in the process with the medication.
Exactly. That's why it's so important to have your doctor kind of looking after you. Adjust the treatment, deal with the side effects, all that.
Right, right. You mentioned drug resistance. How big of a problem is that, and how does that even happen?
It's a huge problem, especially in parts of the world where TB is really common and people don't always have good access to healthcare.
Okay.
It happens when people don't finish their treatment.
Oh.
So they start feeling better and they're like, oh, I'm good. They stop taking the medicine.
And then the bacteria are like, ha, foiled again.
Exactly. That gives them a chance to mutate, develop resistance to those drugs.
Oh, man. So it's like survival of the fittest, but for bacteria. You kill off all the weak ones and you leave the strong, resistant ones behind.
That's a good way to think about it. And then these drug-resistant strains, they're so much harder to treat. We have to use stronger drugs, which a lot of times have worse side effects.
Oh, that's no good.
And treatment takes longer, sometimes 2 years, even more.
That's tough. That's really tough. So what can you do? What can be done to make sure people stick with the program and avoid that whole drug resistance thing?
Well, there are programs, directly observed therapy, DOT.
Okay.
So a healthcare worker actually watches the person take their medicine every time. I know it sounds kind of like, whoa, Big Brother's watching.
Yeah.
But it really helps people stick to their treatment and it reduces drug resistance significantly.
It's like having a medication buddy.
Yeah.
Did you take your pills today? Okay, that makes a lot of sense.
Yeah, and it's also about educating people, supporting them, making sure they understand how important it is to take the medicine exactly as the doctor said, even if you start feeling better.
Okay, that's really important. Beyond the medication itself, are there other things that are part of TB treatment?
Yeah. Sometimes, especially if it's a more serious case, people need what we call supportive therapies. So that might be oxygen therapy if they're having a hard time breathing, nutritional support because a lot of people lose weight, helps them get their strength back. And in some cases, we actually have to do surgery to remove damaged lung tissue or drain fluid buildup.
It's a whole process, so it's not just the medication, it's all these other things to really support the body, get it back to where it needs to be.
Absolutely. And we can't forget about infection control, preventing it from spreading to other people.
Right, because we've got those tiny little droplets and hanging out in the air. What do you do to actually keep those things contained?
People with active TB, we usually isolate them. They have to stay in special rooms, negative pressure rooms.
Oh, okay.
Keeps those infectious droplets from getting out. And anybody who goes in that room, they got to wear a special mask, N95 mask, filters out even the tiniest particles.
It's like in those movies, right? They're in the hazmat suits and they're treating the super contagious disease. It's kind of like that.
It's serious stuff. We got to protect everyone, healthcare workers and just the general public.
Well, this has been a really incredible deep dive. I've learned so much about TB, how it actually works, how they diagnose it, all the treatments, and all the things they have to do to keep it from spreading. What are the key things you want our listener to walk away with?
Number one, TB is serious.
Yeah.
But it is treatable,
Okay.
often curable, with the right approach, catching it early and getting the right treatment. That's what makes all the difference. Number two, if you don't stick with the treatment,
Right.
it can lead to drug resistance.
And then it's harder to fight.
Way harder to fight. And lastly, those infection control measures, they're so important
Yeah.
to protect everyone. Public health, big deal.
These are all such important points. I mean, you've really given us a lot to think about here. Any final words of wisdom for our listener as we wrap up this deep dive on TB?
TB's been around for a long time.
Yeah.
We've learned a lot about it. We've gotten better at treating it. But it's still a problem.
It is?
All around the world, we got to keep researching it, making sure people have access to healthcare, and just keep pushing those public health initiatives. That's how we're going to beat this thing.
Well said. Well said. And for our listener out there, here's something to think about. TB, it's not just a disease of the lungs. It really is a reflection of, social and economic disparities. So as we're fighting TB, we got to think about those underlying factors that contribute to its spreading, like poverty, overcrowding, lack of access to healthcare. It's complicated. It's going to take a lot of different approaches and a real commitment to global health equity. So thank you so much for joining us on this deep dive into the world of TB. I hope you learned as much as I did. CG311